back to Iqramed Learning Academy. Now here in this session, which is Fundamentals of Ultrasound Machine and Knobology Part 2. So I would advocate you to go back to my session which is on Knobology Part 1 so that the link is maintained. Okay. A brief introduction from my side. This is Dr. Sultan Mainuddin Shaukat Ali here. I've completed my MBBS, MD and DNB in radio diagnosis and I'm 14 gold medalist. Now in this session would be now in my session 1 I started from very basics, that is there is a very important knob to start the machine, and then I also discussed that the second important thing, once after placing the patient on your ultrasound table, the most important thing which you need to do is you have to take the right preset and the right probe. Okay, so now if I want to summarize my entire session which we had discussed the last time, it can be summarized as selecting the right probe. So you have to select the right, number one, you have to start the machine. Number two, you have to select the right probe, which is convex probe in case of OBS scan, OBS Doppler scan. And third, very important, is you have to select the right preset. So this is how we start with, and now we are moving ahead, that is we'll be discussing Knobology Part 2. So without any delay, let us start. So now selection of transducer. So this is what you have to select depending upon whether the patient is fat or whether the patient is thin. So here you have two images. Number one, this is the image which is taken by a linear probe, okay, in a patient, and this is the probe which is kept in right hypochondriac region, RHC. So if you have this image of abdomen, it is this region which we are examining. This is the region which is being examined on ultrasound. Okay, so now here you can see that this is a portion of liver, and here you can see this is gallbladder. Okay, but by the way, this patient is thin patient and this patient is obese patient. So in thin patient, you can see that linear probe has good resolution. You are able to see the structures well. But if the patient is obese, it hinders the transmission of ultrasound and you are not able to see the structures with very good resolution. So very important is that if depending upon the depth, if you want more depth, select the convex probe. Very important. Okay. Now let us move ahead. So this is the keyboard of your ultrasound which I have shown you. These are the various knobs. So you see this alphabetical keys and the numlock keys, and you are able to see this exam key, the ID key which helps you to take new ID of the patient. You have got various. Now in this we have discussed about the exam key in the previous session. Now what I would like to discuss is this gain now. What are gain? So initially, if you see the images, gain in easy term is nothing but brightness. Okay, so there are two types of gain. One is gain in the your routine image and one is Doppler gain. So I'll discuss both of them. So what do you mean by gain when it comes to routine image? Let us discuss gain. So with the overall gain, the image quality can be improved, that is by adjusting what we call as brightness of the entire field. Okay, without increasing the intensity of the sound energy. So in short, if you are increasing gain, that means you are increasing the brightness. If you are decreasing the gain, you are decreasing the sound intensity. Okay, so it will become more dark. So when does decreasing gain help? If you want to look for fine calcifications, especially in case of placenta, or if you want to look for placentomyometrial interface, in all these areas, decreasing gain helps. And you have to, more than decreasing, you should put gain to be optimum. Okay, you should have gain which is optimum. Okay, optimum gain is most important. Now, by amplifying the echo signals returning from the body after transmitting the sound waves, increasing or decreasing the overall gain may improve the contrast resolution. So, this is our main aim when we are trying to adjust the image. So, once you select the probe is kept. So, suppose this is the abdomen of patient and you put a probe in this region, the convex probe, and suppose you start seeing the image. You start seeing the image, whatnot. These are some organs. So the next thing which you do is you adjust the gain. Okay, you have to adjust the gain so as to improve the contrast. And after that, the next thing which you have to do is you have to select the depth. So I'll come to that also. Okay, so it works same like microphone. How you adjust the sound. There is amplification of sound and signals. So just like this works with brightness. Okay. Now there is a Doppler gain or D gain knob which helps for determining the velocities. So I'll show you the examples of both of these. Yeah. So now look here in these two images, you can see that in image 1, you look at the intensity of sound. This is 31 decibel. And you see how dark the images are. They are not that bright, they are dark, right? So this is decreased gain. Okay. Now you increase the gain, that is you increase the decibels, the sound intensity. So adequate overall gain of 31 decibel, which shows this lever surface. You can able to see the lever. But suppose if I increase the overall gain beyond a certain point, like in this case, you are not able to make out this subcutaneous tissue and the lever margins separately from each other. So that is when the overall gain of 60, your lever surface gets missing. So what do you learn from this? Your gain has to be optimum. So how do you make your gain to be optimum? Using this button. Okay, and depending upon machine to machine it may vary, but remember there is always a button which helps you to set the gain, okay, and brightness. Okay, that is very important. So number one, you select probe, place the probe. Once you obtain image, the next important thing you do is adjust gain, that is optimum brightness, so that you see various structures separately. Most important. Okay, now let us move ahead to the next important thing, which is D gain, the concept of Doppler gain. Okay. So now look here. So before I start this, you should know some of the basics. Okay. So I'll show you the basics first. Okay. Listen very carefully. I would simplify everything. Okay. Rather than going into boring physics, I'll make it simple for you. So imagine this is a blood vessel. This is a blood vessel. Okay. This is a blood vessel. So now blood is flowing within this. Okay. Now you can see the blood vessel even on 2D scan. So you will be able to see the wall of the vessel on grayscale imaging. So grayscale imaging would show you that there is a vessel with wall, but the lumen would be anechoic, correct? The lumen would be anechoic. What do you mean by anechoic? Anechoic means completely dark. Okay, completely dark. Okay, fine. So that is how you look at the vessel. Now, the next important thing is this was examining in B mode. So this is called B mode examination. When you examine a vessel in B mode, you just see the wall of the vessel. That's all. Sometime if there is atherosclerotic changes, you can see that there is atherosclerosis. Okay. Chalo, itna samajh gaya. Now let us move ahead. Next is what is called color box or color Doppler. Color Doppler. So color Doppler simple. What do you have to put is you have to put a color box over it. Okay, you put a color box over it. So this is called FOV, field of vision. Okay, and the box is called color box. Okay, once you put this color box over this vessel, the area which is within this vessel, so vessel within this box, it would show you color. So if the flow is towards the probe, and depending upon your adjustment, you will have to see towards को अपन ने scale में क्या रखा है. So towards the probe, if routine adjustment, it is red in color. Okay, so the entire area becomes red, and you see that there is flow within it. Okay, this is how you see the this is color Doppler. Okay, now next one. So you have seen color Doppler. Now we come to, so if you see B mode and you see color Doppler, this is called duplex Doppler imaging. Okay, and now what you do is you add a third important thing, which is called spectral Doppler. Don't be afraid. I'll explain this thing to you. Spectral Doppler. So what is spectral Doppler? So if you see, if you remember the buttons which I have shown you, let us come back to the buttons, the B mode. So this is the grayscale imaging. Then you see this is color Doppler. So as soon as you press this, you will see that there is a color box which appears, and it will show within the vessel the flow is there or not. Okay, and then you have this buttons here, which is power Doppler and color. Yeah, PWCW. So this is called spectral Doppler button. So we'll see the knobs. So what happens once you press the spectral Doppler? Once you press the spectral Doppler, you get such a you get such appearing symbol. So this is the symbol which you get once you expect the spectral Doppler. Okay, this is the symbol. So now this gap between this, you are able to see, this is called gate. Okay, this is called gate. And so this gate can be increased or decreased, but very important, very important, this gate should be kept such that it is in the center of the lumen and it occupies 2/3 of the luminal diameter. Okay, 2/3 of the luminal diameter. Okay, such is the gate. Now if you see this angle, this angle, so now there are two things. One is this is the flow of blood, and one is this, the angle along the symbol. This is the angle of insonation. So this angle is formed between the flow and insonation. Okay, now very important, so to get the most accurate values on Doppler, remember that this theta has to be 0, or at least we have to try this theta to be less than 60 degrees. Okay, very important. Now if theta becomes 90 degree, then ideally, theoretically speaking, it should not show any color flow. Okay, because the Doppler shift is directly proportional to cos theta, that is cos of angle between them. Cos 0 is 1, so you get maximum accuracy, whereas cos 90 is 0, so the Doppler shift becomes 0. Okay, so that is why, where do I apply this? इसको use कहाँ करेंगे? So when it comes to any Doppler, limb Doppler or anything, you should try to keep angle less than 60 degree. If you don't keep this, your Doppler is useless. Okay, now there are few important, very important parameters like fetal MCA, where in case of fetal MCA, that is, what is MCA? Middle cerebral artery, you have to keep Doppler angle between 0 to 20 degree. So less than 20. You cannot increase even beyond 20 degrees. So you have to keep that accuracy when it comes to Doppler angles. Okay, angle of insonation. Okay, any mistake in this angle of insonation or angles would give a drastic difference in PSV, in the waveform pattern, etc., etc. Okay, so most important part when it comes to Doppler is this. But presently I want you all to focus on important thing, that is what is gate, the sample gate which I have kept in the vessel. Okay, and then there is angle of insonation. And once you put this inside the vessel, why is it called spectral Doppler? Once you put this and you press the button of set or enter, you get a specific waveform of that vessel. So suppose you get such a waveform. So this is how you start getting the waveform. So this waveform which you get once you put that, this is called spectrum. This is called spectrum. So जितने भी arteries है body में, carotid artery, you will get carotid body spectrum. Suppose you speak of vein, you will get spectrum in veins also. Suppose you have renal artery, you've got renal artery spectrum. You've got various arteries, umbilical artery, uterine artery, you name an artery, even external carotid, internal carotid. Similarly, you have got external iliac, internal iliac, common femoral, whatever arteries, veins you label, all of these have got a particular spectrum. So when you just see the color, that is your color Doppler, and when you put waveform in that, that is your spectral Doppler. Okay, and when you just see it routinely, that becomes your B mode imaging. Okay, this, hope that this clears the fundamentals. Now we'll apply whatever we have learned here. So let us apply this to a beautiful example. Okay, let us see now. You look at this beautiful case here. So here, are you able to see that this is the ultrasound image and you are able to see this blood vessel? I'll trace it for you. So this is which image? This is grayscale image or B mode image. This is B mode image. Okay, and here you are able to see the walls of the vessel. These are the vessel wall. Okay, and now what have we done? We have put no color box, we have put directly spectral Doppler. So to put spectral Doppler, you need not put color, you can put spectrum even without putting color also. Okay, now, so are you able to see this? This is angle of insonation. So if you see, this is the flow of blood and this should be the angle between them, that should be kept less than 60 degree. Okay, ideally we should try to bring it to 0 degree. Okay, if not 0, less than 60. Okay, now you understood this. Now I move ahead. Now let us look here. Look here, look at this. You are able to see this sample gate which is kept inside the lumen of the blood vessel, and as soon as you are able to see this, so this is the angle, and as soon as you click the set button, you are able to get this waveform. This waveform. Okay, so this is called spectrum. Now, point to be noted, if you see, this is spectrum in the same vessel. However, if you see this area, this is quite dark, the velocity. So what is it? This is nothing but a graph of velocity against time. Very important. This is the fundamentals. Okay, many people are very much afraid of what all these things are. So let us make it very simple. ये क्या है? This is graph of velocity against time. So always, बचपन से याद रखा है हमने, time is always plotted on x-axis. So this is x-axis and इस पे हमेशा time होता है. Okay, and इस पे हमेशा velocity होती है y-axis पे. Okay, y dash, and x-axis पे हमेशा time होता है. So what you have is, this is the waveform on that particular time. Okay, now if you see here, you are able to see that the waveforms are dark and the velocities are intermingled, so you have got mixed velocities. But if you look here, this area, the spectrum is good, here the spectrum is not good, Plus you see the peak velocity here is different from peak velocity here and the peak velocity here. So why is this so? Because of different D gain or Doppler gain. So excessive Doppler gain is seen like this. So this is an example of excessive Doppler gain A. Insufficient Doppler gain is this C, that is low PSV. Okay, and if you put it adequate, you get such waveforms. Okay, so once you set the Doppler angle, then at the particular side, the gain is such kept so that you get minimum noise and you get a very good spectral waveform instead of mixed waveform. Only then you will get a reliable PSV or peak systolic velocity. So this was the function of D gain. Once again, to remind you, I want to show you the button of B gain, D gain. Okay, here. So gain and D gain. So to summarize, what have we seen? We have seen that once you start doing ultrasound, after you selection of probe, after selection of preset, the next important thing which you have to look for is gain. Gain is nothing but brightness. We have seen the routine gain on our B mode imaging, that is you have to put the brightness to optimum so that the image resolution is good. Similarly, we have seen about power Doppler and spectral Doppler. So we have seen that how do you apply color within it using color box button, and then how do you put the spectral Doppler within it with angle of, and we have seen basic terminologies, that what is sample gate, how it should cover 2/3 of the vessel wall, and very important, we have seen that uh, the what is D gain, and that also should be kept optimum so that the whatever velocities you get are reliable. Okay, so now again, I am zooming it and I am showing you well all this important norms. So this is your routine B mode image. B mode image यानी you will be आपको सिर्फ vessel wall दिखेगा. Okay, this is B mode imaging. This is grayscale image. Okay. Harmonic imaging, I'll come to this in our subsequent session. I won't tell you details now in this session, but it's a different type. But this is also a B mode imaging, a type of B mode imaging, special type. Okay. Now coming to color Doppler, power Doppler. So these both are color. So if as soon as you click on this, you see a color box. Both of this, you see color box, and you see that there is flow within the vessel. So depending upon this, either there is red flow or blue flow, depending upon how you have set the scale. Okay. But very important, when it comes to power Doppler, this is not dependent on direction. So it will show a single color. Power Doppler will show a single color. Okay. Now this is spectrum. So what is spectrum? So once you press this, you see such an appearance. Okay, and so that is to be kept within the vessel using your cursor or scroller, and after that it is placed such that it occupies 2/3. The next important thing is click on the set button and you will get waveforms, and once you start getting waveforms, the next important button you have to press is freeze, and as soon as you press freeze, you get the entire thing, and whatever measurements are to be made is measured. Okay, now in this image, I take this as an opportunity to show you one more knob, this one. This is called M mode. Okay, all ultrasound machine has got M mode also. So very important, what does M mode stand for? M in M mode stands for motion. So this is a very sensitive technique in ultrasound to detect even fine motions. So this is used everywhere where there is motion. So you know when there is motion in case of fetal heart, especially the walls, the valvular leaflets of the fetal heart would move. So that is where we can use the M mode in order to calculate the heart rate. Okay, heart rate can be calculated by various methods. One is direct, you can put a waveform in that and you can take peak to peak, or second is you can do it using M mode. We'll see that in specific lectures belonging to those category. Now, okay, now we come to specific other buttons which are there, other knobs. So you have got this focus button, depth, filter, PRF, pulse repetition frequency, and baseline. So in subsequent lectures, I'll also talk in brief about what are these knobs useful for. Now, basically you have understood what I'm trying to explain you is that you should know कि आपके पास जो चीज है उसका बेस्ट इस्तेमाल कैसे करें. सपोज आपने अपना अल्ट्रासाउंड का मशीन चालू किया और आपकी स्क्रीन इतनी बड़ी है सपोज, and out of that suppose you are using only this much of portion. Suppose you want to see liver and you are seeing itna liver and the rest of your skin is all artifacts, then that is not optimum. You have to adjust the depth properly. So you have to decrease the depth and zoom the image, so that, and you have to adjust the proper gain, so that what you have you can make maximum out of it. Okay, so that is what is the main aim when it comes to understanding knobology. So if you understand your machine well, you will get good B mode image, and if you get good B mode image, the next comes is the color scan, and if you understand what the color images are, that is the Doppler image, then comes the spectrum. Okay, spectral Doppler. Okay, so this goes one by one. Okay, so here I would end this session, and in next session we'll continue further, and I'll discuss further on the various knobs, the physics part, and more important, rather than discussing knobs and physics, what I'm trying to tell you is that हर चीज काम कैसे आएंगी आप, that is more important. Okay, how this would be useful to you in your practice. Okay, fine, we stop here.